Hi everyone, today we are doing a neurotoxin treatment. We are starting out in this patient's frontalis. She likes to have a really nice arch to her eyebrow, so I am making sure I am keeping my injections very high. I want to settle some of the movement in her forehead to help with fine lines, but also maintain a little bit of that muscle activation right above the arch of her eyebrow. So personally, I do not mark as I go through, like prior to doing my injections. I like to kind of go through assessment with the patient, choose my dosing and what I think I'm going to use, and then go ahead and just kind of eyeball, for lack of better terms, as I'm going through, just using my aesthetic eye of where I want to place these units. So I'm having the patient animate and just lift up her eyebrows as we're going through and choosing our locations for injecting. But like I said, I am just making sure that I am staying high up on that frontalis muscle to avoid any sort of brow ptosis, and specifically for her to make sure we're getting a really nice brow lift. Now we're going in and treating our glabella. This is a depressor muscle, so treating this will help elevate up and give her a medial brow lift. So again, I'm having her animate by making that angry face, and I am going for the insertion point on that corrugator down near the brow bone. I like to pinch and hold as I'm injecting just to make sure I can feel and know exactly where I'm going. And for her, we are treating the highest dose right in her medial portion, and then just a little bit in her lateral tails. But again, my goal is to lift up her eyebrows as much as possible, so I am not doing a very significant dose in those lateral tails. And for her, she doesn't have very strong glabella movement. I had her even animate twice there just to choose my injection point, but I wanted to treat the medial portion for sure to help with her brow lift. Now I'm going in and doing just the tail of her eyebrow with a little bit, just a very small dosing of units here. She already has a really nice arch to her eyebrows, but we're just looking to maintain that. We chose to opt out of treating her crow's feet today. She didn't wish to treat her crow's feet. We do that for her maybe every few times she gets toxin treatment, but as you can see, she has beautiful skin. Everything that we're doing is preventative. Now we're moving on to her nasalis. I'm having her animate and then placing my units on each side of that muscle. Then going into her mentalis, again having her animate and then placing our units. So I'm having her pull up that lower lip and find the belly of that muscle, and I come at a little bit of an upwards angle there to inject. And for her, we do a little bit deep as well at the top of that mentalis to help loosen off the bone for a little bit of projection. Moving on to our DAO, again having her animate and placing my units. I go about half needle depth and always injecting away from the muscles that I am trying to avoid. So just injecting back along her jawline. Moving on to her masseters. We've lowered our dose in her masseters. She does have TMJ pain, so that is our reasoning for treating, but she was starting to see some atrophy, and I recommended just going down on her dose a little bit. We're still treating for pain, but I didn't want as much atrophy to occur after this treatment, just to maintain the structure of her jawline. We did both her deep and superficial masseters, and now we are going in with a lip flip. This patient does have lip filler, but she likes the look of having just a top lip flip, so again, just treating that very superficially.